Hi there. Thank you for joining us again today as we continue our series and the conversation of your doctor and COVID. I am Dr. Mahendra Carpen, the head of medical services and cardiology at the Georgetown Public Hospital Corporation. And remember, if you have questions, you can send them to us on WhatsApp at 620-6275 or send an email to docandcovid@gmail.com. I'll take my mask off for the rest of this session as we continue our conversation so you can understand me a little better. So today we will be looking at a series of questions, one in particular that was posed to us by a listener or a viewer, which is quite common actually. And the scenario is this: I tested positive for COVID-19. At the end of my 14 days lockdown, do I need to be tested again? And that's a very important question. As you know by now, we have more than 4,000 cases of persons who would have tested positive for COVID-19 in Guyana. And so I suspect we have at least 4,000 people who would have at one time asked that question, either to themselves or to their friends, family, or their healthcare providers. So what does a positive, or what does your test result actually mean? If you test positive for COVID-19, take these steps to help prevent the spread of COVID-19. The first main thing is to stay at home. Do not leave your home except to get medical care if you become really sick, and do not visit public areas. It would actually be quite irresponsible if you knowingly have positive COVID-19 status and then you were to go in public and expose others. Get as much rest as you can and stay hydrated. Over-the-counter medications such as Tylenol, Panadol, acetaminophen, these are all the same thing that are used to help reduce fever. You can use those as well as your vitamins to boost your immune system. It is important for you to stay in touch with your doctor, your hospital, your local healthcare provider, and separate yourself from other people in the home as much as is practical. We are very aware that in many homes in Guyana, it is difficult to actually separate yourself because many persons inhabit the same room, for example, but you will try your best in those circumstances to minimize the contact or the close contact you have with other family members. There are two types of tests right now that are being utilized in Guyana, and we're going to look at the differences between these two tests. The main tests that we use are the swab test or the blood test. The swab test, this is the real diagnostic or PCR test, versus the blood test. This is the antigen test. And let us look at some differences between these two. The swab test, this is the PCR, it takes days, versus the antigen test, which takes minutes to seconds in some cases. In the swab test, the test is taken from the nose or the throat. The blood test, of course, a blood sample is required. What happens after the sample is taken from the relevant site? For the swab test, the lab will then run what is called a polymerase chain reaction test, or a PCR. That is the gold standard diagnostic test. What happens after you take the blood test? A solution is actually added to the test device. It works in the PCR case by looking for the coronavirus genetic material. So if it's present, the test will be positive. If it's not, the test will be negative. In the antibody test, this is then used to detect antibodies, which are created by your body's own defense mechanism to fight viruses. And in both cases, let us look at what a positive result actually means. A positive PCR or the swab test means that the patient has the virus. A positive blood test for antibodies mean that the patient has had the virus in the past. So it is very important to recognize those differences. The PCR test tells you that you have it. The antibody tests say you may have had it in the past. The WHO and the CDC have come out with new guidelines as to when patients can exit quarantine. Quarantine is when you keep yourself away from other potential persons, of course. If you test positive and you have had 10 days of isolation, that is considered a good first benchmark. So 10 days of isolation after symptoms or positive test, plus 3 days with no fever or any need for fever reducing medication. So that is the 10 plus 3 formula where you are considered safe. So you would have tested on day 1, 10 days passed, and then an additional 3 days of no fever or not needing any fever reducing medication. That's the 10 plus 3 formula we use to say it is safe for persons to re-enter society or go back to their jobs, etc. Important to differentiate, academic importance I suppose, between isolation and quarantine. And what is isolation versus quarantine? And isolation essentially is used for people who are confirmed or suspected to have COVID-19. They're suspected based on their symptoms. We use this strategy in order to keep persons from infecting others. And it could be done at home, a healthcare facility, or an isolation facility. So that is isolation. What is quarantine as it relates to this whole concept? Quarantine is actually used for people who were potentially exposed to COVID-19, but they are not sick. So you don't know if they're positive, but they were exposed, okay? And we do this strategy because this person could have the virus in their body even without symptoms. And so they therefore can pass it on to others. And we want to quickly identify early symptoms. And again, this can be done at home or in a quarantine location. When we started out our fight in Guyana, we tried to quarantine and isolate people in government-run facilities. But as the number of cases started to increase, it became a significant challenge based on the available resources we have and the available centers that we have to perform these functions. So let us summarize the difference between isolation and quarantine. Quarantine means restricting activities or separating people who are not ill themselves but may have been exposed to COVID-19. The goal is to monitor symptoms and detect new cases early. Isolation, on the other hand, means separating infected people to prevent the spread of COVID-19. And a third concept that is part and parcel of this strategy is physical distancing or social distancing, which means being apart but socially connected, for example, through chat or video call, telephones, etc. So I hope that would have clarified some differences between isolation, quarantine, and physical or social distancing. The other concept that we need to clarify is that of close contact. What do we mean when we say close contacts of COVID-positive patients should be isolated? Well, who are close contacts? Persons who would have been exposed to more than 15 minutes of face-to-face contact within 2 meters or about 6 feet from a known infected person. That's a close contact. A person living in the same house or shared accommodation with a known infected person. That is also a close contact. Transmission is also, however, possible in a shorter time interval. Health staff dealing directly with known or suspected cases in particular settings, for example, in the Georgetown Hospital, we have a lot of our doctors treating COVID-19 positive patients. In those patients, the concentration of the virus in them are much higher, so it can be transmitted a lot easier from those patients to the healthcare providers who are in contact with them for perhaps shorter time, which is why it is very important that we continue to provide the needed and necessary personal protective equipment to all healthcare providers, especially those who are going to be in contact with those COVID-19 positive patients. If you have been in close contact with a confirmed case of COVID-19 in the last 14 days and you have symptoms, you should stay away from other people and phone your doctor or make contact with the hotline. If you do not have symptoms, restrict your movements. So what is a COVID-19 exposure? Remember, all of these concepts actually have definitions. An individual who has had close contact less than 6 feet for more than 15 minutes. That is a classic textbook definition of a COVID-19 exposure. This is someone who has been close to, as defined as less than 6 feet, and more than 15 minutes time interval next to a person who is known to have COVID-19. Exposure to person with COVID-19 who has had symptoms including 2 days before symptom onset. That is considered close contact and exposure. Person who has tested positive for COVID-19 but has not had any symptoms. That is also considered a risk exposure. So we have been looking at all of these concepts. What are isolation, what is quarantine, what is social distancing or physical distancing, what is considered to be positive exposure. So these are all important concepts that we have used in order to develop our public health strategy. So what should a person who tests positive, what should they do? Well, the most important thing that they can do for themselves or the society and those that they come in contact with is to isolate, to stay at home, except in conditions where they themselves need to get medical attention. Patients should monitor their symptoms, particularly fever, cough, shortness of breath. They should avoid contact with other people or pets and stay in separate rooms if possible. Remember, I mentioned the challenges that we have sometimes with large number of persons sharing the same room. If you can avoid it, avoid sharing household items like cups, towels, and utensils. Wear a mask when you're around other people. The wearing of masks is quite an important public health strategy to minimize the spread of COVID-19 in our population, and not just us, but around the world as well. In a positive COVID-19 person, what should you do if you're positive and you're feeling sick? Well, first of all, let us identify the high-risk population. These are persons who are 65 years or older, or people with medical issues such as heart disease, lung disease, diabetes, high blood pressure, or cancer, and are at higher risk for getting very sick from COVID-19. This is the group that often end up in the ICU. If you develop fever or symptoms, you should call your doctor, call the hotline, call the hospital. If you are sick enough to be hospitalized, you can recover at home, but follow your doctor's instruction or refer to all the local standard recommendations of what to do when you're sick. In the general population, if you are generally in good health and you have mild illnesses, you could actually just stay home and observe and monitor yourself. If these get worse, of course, you seek medical attention. The particular question that deals with retesting in persons who would have had COVID-19 positive tests previously, that's an important one because we first started out this fight requiring that patients have a negative test before you release them back into society, back to their jobs, etc. But the guidelines have changed. Patients with COVID-19 disease can have persistently positive PCR tests for several weeks. So what do you do with those persons? Should you keep them at home? It is not quite practical. The clinical significance of a persistently positive PCR test is less clear. You should use, or doctors should use, the clinical endpoints or the clinical targets like fever, cough, shortness of breath, symptoms when determining patients' ability to re-enter society. The CDC, or the Center for Disease Control, includes the use of clinical endpoints for clinical management and discontinuation of isolation precautions. So it is not necessary for you to have a repeat test after 14 days, but rather use the clinical criteria to determine when it is safe to re-enter society. So remember to send us your questions at 620-6275 on WhatsApp or email at docandcovid@gmail.com. Thank you again for joining us.